I'm Dr. Hello, can you hear me? Hello? Yeah. Hello, friends. I'm Dr. Jayanti Kamat, IVF consultant and practicing obstetrician and gynecologist for the past 22 years. So, previously, I have posted videos on cesarean section. What are the different indications for cesarean section? Can a vaginal birth after cesarean section be possible? And today, as the third in the series, I'll be talking about care and precautions after cesarean delivery. Now, whenever a woman is told that she has to undergo a cesarean section, there are two types of reactions. The first one is sometimes a woman is relieved that she says that I have been in labor for so long and at last they are taking me up for a cesarean section. But there are other women who are very disappointed because there is a change in their birth plan. She was mentally prepared, or the doctor had planned to deliver her vaginally, but all of the sudden the birth plan has changed and she has been posted for cesarean section as an emergency. Remember, friends, please take this positively, and whatever is done, just remember that it is done in the best interest of the mother and the child. At the end of the day, whether it's a normal delivery or a cesarean section, the mother has to be healthy and the child also has to be healthy. Now that the woman is posted for cesarean section, she's taken to the operation theatre. Usually, cesarean sections are done under spinal anesthesia. स्पाइनल एनेस्थेसिया क्या होता है कि एक छोटी सी सुई जो रहती है वो पीठ में डाला जाता है, वहां से आपको एनेस्थेटिक्स ड्रग्स दिए जाते हैं और बॉडी का जो निचला हिस्सा रहता है वो शून्य हो जाता है. सो द पेशेंट इज अवेक. Why do we adopt spinal anesthesia for cesarean sections? Because that is the safest anesthesia for the mother and the baby. So once the baby is out, then usually the mother is given certain sedation. So we give sedation to the mother. Why? Because to allay her anxiety. And sometimes these mothers get very excited when they see or hear the voice of the baby. Now, an average cesarean section takes about maybe 25 to 45 minutes maximum in the operation theater. पेशेंट को ऑपरेशन थिएटर से बाहर लाने के लिए थोड़ा सा वक्त लगता है, because cesarean section, though it is quite common, it is a major surgery. The patient has to be observed for her pulse rate, her vital parameters, her blood pressure, whether it is stable or not, whether she is bleeding, whether she is passing urine. All these things have to be checked and the patient has to be stabilized. So once the patient is stabilized, patient को OT से बाहर लिया जाता है अपने रूम में या वार्ड में. तो वहां क्या माहौल रहता है? तो रिलेटिव्स आर वेटिंग वेरी एंशियसली टू सी हर एंड बहुत खुशी का माहौल रहता है, मिठाइयाँ बांटी जाती है. सो ऑल दैट एटमॉस्फेयर इज देयर. लेकिन याद रखिएगा कि दिस पेशेंट हैज अंडरगॉन अ मेजर सर्जरी and this woman might have been labor for quite a few hours, and now that she's sedated, she requires a lot of calm and peace and needs to rest. So ज्यादा शोरगुल नहीं होना चाहिए. The patient needs to rest. अभी स्पाइनल एनेस्थेसिया दिया गया है, पाँव नहीं हिल रहे हैं बिकॉज शरीर का निचला हिस्सा जो है वो शून्य किया जा रहा है. पेशेंट इज वेरी ड्राउजी. दो नलियां लगी हुई है, एक तो आईवी फ्लूइड्स की और दूसरी जो है वो पेशाब की नली है. Patient cannot move the legs for a few hours. She cannot turn this way or that way. So she's very uncomfortable and like very anxious. So these patients require rest. दूसरी बात है बेबी की. The moment people see the baby, they get very excited. तो बेबी को एक हाथ से दूसरे हाथ तक, it is everybody wants to hold the baby. So this should not be done because the newborn baby is very susceptible to infections. तो बाहर से आते हैं लोग, then some people bring gifts, some people bring flowers. तो जो flowers में जो pollen होता है, that can be an allergen. So just ये सब चीजों से आपको दूर रहना है. अभी between 2 to 4 hours after cesarean section, रिलेटिव्स पूछते हैं डॉक्टर को कि डॉक्टर क्या खाने के लिए क्या दे दूं. तो जो भी फर्स्ट 24 आवर्स में जो भी खाना या जो भी न्यूट्रिशन देना होता है वो सब आईवी फ्लूइड के द्वारा पेशेंट को दिया जाता है. सो यू नीड नॉट गिव एनीथिंग ओरली टू द पेशेंट. हाँ, कभी कभी पेशेंट बोलती है कि मेरा मुंह सूख गया है, आई एम हैविंग अ लॉट ऑफ ड्राइनेस इन द माउथ, तो तभी एक वेट कॉटन से पेशेंट का मुंह गीला कर सकते हैं और शी कैन जस्ट हैव अ स्मॉल सिप ऑफ वाटर. सो द फर्स्ट 24 hours usually everything IV fluids will be started for the patient. Then coming to breastfeeding, which is very, very, very important. So after 3-4 hours after cesarean section, the nursing staff will try to lash the baby to the breast. तो यहाँ पे भी काफी लोगों का ऑब्जेक्शन रहता है. रिलेटिव्स होती है, पेशेंट की माएँ होती है, सासू माँ होती है, वो बोलते हैं कि मैडम अभी अभी तो थक गई है, इतना बड़ा ऑपरेशन हो गया है, दूध भी नहीं आ रहा है, सो व्हाई यू आर फोर्सिंग हर टू ब्रेस्ट फीड द बेबी. See, breastfeeding, the success of breastfeeding is the sooner you start, the better. Or the baby has to be latched on to the mother's breast as early as possible. तो पहले दिन तो दूध तो नहीं आएगा, लेकिन जो कोलोस्ट्रम रहता है, वो जो स्टिकी फ्लूइड आता है, वो बच्चे के लिए अमृत के बराबर रहता है, because it contains a lot of antibodies and immunoglobulins which protect the baby from infection. दूसरा कारण ये होता है कि जब whenever the baby suckles the breast, ब्रेन में से एक हार्मोन ऑक्सीटोसिन नाम का जो हार्मोन होता है, so that gets released, so that stimulates the breast to produce milk, plus it has an action of the on the uterus as well. The uterus contracts. यूट्रस जब कॉन्ट्रैक्ट होता है तो ब्लीडिंग भी कम हो जाता है एंड पेशेंट्स रिकवरी आल्सो is fast. So that is why it is very important to start breastfeeding within the first 4 hours. The sooner it is started, the more successful will be the breastfeeding program. कई लोग सोचते हैं कि ऑपरेशन हुआ है, पेशेंट को आराम चाहिए, ठीक है, अभी फॉर्मूला फीड दे देंगे और 3-4 दिन के बाद हम ब्रेस्ट फीडिंग चालू करेंगे. नो, इट डजंट हैपन दैट वे. नाउ कमिंग टू द नेक्स्ट डे. नेक्स्ट डे पेशेंट का बाउल साउंड्स, क्या जो आंतड़ी है, जो इंटेस्टाइन्स है, उनकी चाल चलन देखी जाती है. सो व्हेनेवर द डॉक्टर विल पुट अ स्टेथोस्कोप ऑन द पेशेंट abdomen to see whether there are bowel sounds or whether the intestines are moving. So once those sounds are heard, then she will be put on orals. तो पहले पानी लेने के लिए बोल देते हैं. So if the patient does not vomit, then we can start liquidish food. जो कंजी वाटर, जो नारियल पानी, जूसेस और खीर, all those liquid diet can be started. And on the same day, by evening, even semi-solid diet can be started. The urinary catheter will be removed and patient will be asked to drink water and go to the bathroom. अगर उसको यूरिन पास करना नहीं होता है, if she is unable to pass urine after removal of catheter for 3-4 hours, then you have to call the nursing staff or inform the doctor. Next day, the patient can also sit up or propped up position. You can tell the nursing staff to give a slightly propped up position और फीडिंग करने की कोशिश करनी चाहिए. Of course, she will require help from the nursing staff. She will require help from the relatives as well, but she should try to feed the baby. Now the question is asked, how do I feed the baby? So you can just sit up on the propped up position, put a pillow on your lap, place the baby on that and try to feed the baby. Or in the lying down position, you can lie down on one side, feed the baby, or you can hold the baby in the what is called as the football position. तो बेबी को कैसे होल्ड करना है, ये हॉस्पिटल से सीख लेने का. डोंट यू मस्ट try to get used to holding the baby and how to latch the baby onto the breast properly. The nursing staff of the hospital will guide you in this. After that, the woman will have to take lot of fluids because IV fluids तो अभी बंद हो गए हैं. पहले दिन में IV fluids काफी सारे जा रहे थे because that was the only mode of nutrition for the patient. लेकिन अभी तो डॉक्टर ने बोला है कि सॉलिड फूड खाओ, सेमी सॉलिड फूड खाओ, लिक्विड फूड खाओ. So she also has to maintain a hydration, drink at least 3 to 3.5 liters of water because hydration is very important for her to replace her body fluids as well as to feed the baby. Then she will have a little bleeding after cesarean delivery. थोड़ा सा ब्लीडिंग तो होता ही है, बट इफ द ब्लीडिंग एक्सेसिव कि एक एक घंटे में 2-3 पैड्स भीग रहे हैं, then it has to be brought to the notice of the doctor. Then on the third day the patient will feel more comfortable, and now she'll be able to slightly move on her own. She'll be able to hold the baby on her own. थोड़ा सा आपको डॉक्टर बोलेंगे कि अपने रूम में थोड़ा सा चलो, टेक सम 8-10 steps here and there, just walk around a little bit. So जितना जल्दी पेशेंट वॉक करेगा उतना जल्दी पेशेंट के लिए अच्छा है. When I say जितना जल्दी, it means on the second day. Okay, nobody is expecting to expecting the patient to get up on the first day. तो second day पे जितना जल्दी चलेंगे या थोड़ा सा they are going to take steps, go by themselves to the bathroom, उतना अच्छा रहता है. उसको हम ambulation बोलते हैं. Then probably on the third day or on the fourth day, if all is well, the doctor may discharge the patient. So discharge करने से पहले the doctor may change your dressing, put a waterproof dressing, and then ask you to go home. So on that day, जो भी आपको discharge card पे लिखा होता है, please understand it properly. अगर आपको समझ में नहीं आता है, तो आप डॉक्टर से पूछ सकते हैं, नर्स से पूछ सकते हैं. Then you go home, and then what is the diet which you should take during cesarean section? You should eat a diet, full diet, जो भी अपना जो नॉर्मल खाना जो रहता है, सब्जी, रोटी, दाल, चावल, दही, दूध, सब खाना चाहिए. अभी पेशेंट, कई लोगों का ऐसा कहना है कि अगर चावल खाएंगे तो टाके पक जाएंगे, ये खाएंगे तो वो हो जाएगा, बच्चे को सर्दी हो जाएगा. So don't believe all these myths. You need to have a full diet because आपका ऑपरेशन किया हुआ है, and remember the stitches on the abdomen will be removed maybe on the 8th or 10th day. लेकिन जो अंदर के स्टिचेस होते हैं तो उनको कम से कम 4 से 6 हफ्ता लगते हैं भरने के लिए. So this healing requires a lot of nutrition and lot of protein. So you should have a protein rich diet and less of carbohydrate and very less of fats. हमारे देश में देखा जाता है कि यूजुअली द प्रेग्नेंट वुमन इज गिवन ऑल स्वीट फूड, जो मीठी खीर बनाते हैं, मीठा वो बनाते हैं, मीठा ये बनाते हैं. सो डोंट ईट टू मच ऑफ स्वीट्स एंड एम्प्टी कैलोरीज. घी खा सकते हैं बिकॉज घी इज रिक्वायर्ड फॉर द एब्जॉर्प्शन ऑफ फैट soluble vitamins, but nothing should be in excess. After that, on the 8th or 10th day, the doctor will call you for stitch removal. So once the stitches are removed, the wound is healthy, then you can have a bath. And in between period, जब भी आपको ध्यान रखने का है, अपने टाकों का ध्यान रखने का है, you should see that their dressing does not become wet. Once you are discharged from the hospital, and suppose you feel that there is some fluid which is oozing from the wound, your dressing is getting wet, then you need to contact the doctor immediately. Or if you are having excessive bleeding, you should contact the doctor. Or if your child is not suckling well, बच्चे को पीलिया हो गया है, then also you need to consult the doctor or the pediatrician. Now, there are many questions which are asked after cesarean section. The first question is, खाने पीने का तो मैंने बोल दिया है, you need to have a full diet. Then what about exercise? Exercise you can do walking or simple breathing exercises or yoga. Do not do any strenuous exercise. For 3 months you should not lift anything which is heavier than your baby. तो ज्यादा बेंडिंग करने में या झुकने में थोड़ी सी दिक्कत हो सकती है. And whenever you're getting up from the bed, you should always turn on one side and get up slowly. झटके से नहीं आपको उठना है. So all these precautions have to be followed. Then the bleeding part of it. First few days the bleeding is going to be red in color. Next few days we call it lochia rubra. Next जो दिन रहते हैं, you will find slightly pinkish color, जो lochia serosa बोलते हैं, and then the discharge becomes a little whitish called as lochia alba. So this is the pattern of bleeding. But suppose you are having very heavy bleeding, you're passing a lot of clots, you're feeling very fatigued, feeling dizzy, then you should consult your doctor or bring it to the notice of your doctor. Now, regarding breastfeeding. Breastfeeding, the preparation for breastfeeding has to be started before delivery. How it has to be started? Like you have to take care of your breast, you have to see whether the nipples are proper whether the skin around the nipples is not dry. The nipples should not be dry or cracked. You can apply any oil or moisturizing cream before delivery. तो अगर आपका nipples अंदर गए हैं, तो when you're having your bath, you should try to pull those nipples out and apply some lubricant or moisturizing cream. So this care of the breast has to be taken during pregnancy, because many a times after the woman delivers, when we examine the breast, the nipples are all inverted. So how will the child suckle the breast? Then secondly, how long to breastfeed? You should breastfeed as long as possible, because as I said, breast milk जो होता है बच्चे के लिए अमृत जैसा होता है. You need not give the child anything from outside for the first 6 months. Okay, so I always encourage exclusive breastfeeding for the first 6 months. After 6 months, you can start top feeds. तो बच्चे को 1 साल तक और 1.5 year तक आप breastfeed कर सकते हैं. तो people who breastfeed the child for a long time and breastfeed exclusively जो breastfeeding करते हैं, उनका वजन भी जल्दी घटता है. They come back to the pregnancy weight a little faster than those who don't breastfeed. So if a woman is exclusively breastfeeding the first 6 months, her periods may get delayed, probably for a year. And if a woman is following the routine of, thoda top feed, formula milk feed, and combination of formula milk feed and breastfeed, then she may have a first period after 3 months. Now, here again a note of caution. Do not think that breastfeeding is going to act as a contraceptive. Since I have just given you an idea, but do not use this breastfeeding as a contraceptive. After 6 weeks, after your cesarean section, you must talk to your doctor about the method of contraception, because minimum of at least 2 years or 3 years spacing has to be followed, because the mother has to recover. And remember, there is a scar on the uterus, it has got to heal. So a pregnancy immediately after a C-section will be disastrous to the mother. So spacing आपको follow करना है, contraceptive method आपको follow करना है. Many a times it so happens when we talk about contraception to our patients, then they don't pay attention to it, and within 2 months or 2.5 months they come with a pregnancy, and that time they do not want the pregnancy कि डॉक्टर क्या करें, हो गया अभी abortion करो. So that is not right. So you have to take precautions right in the beginning. Now talking about weight gain, lot of people are very apprehensive about Caesar कि मेरा पेट बढ़ जाएगा, मेरा वजन बढ़ जाएगा. Yes, remember that you have put on weight over a period of 9 months. Pregnancy में तो weight gain होता ही होता है, लेकिन to lose weight also you need time, because after your cesarean section or a normal delivery, you must pay more attention to your health and recovery and the baby. So you can start with light exercises like walking, yoga, breathing exercises, and after 3-4 months you can start your regular exercises. So with a healthy diet and exercise, you can lose weight over time. Then intercourse after cesarean section. Usually we tell a patient not to have intercourse at least 3 months after cesarean section. So this is the care which you have to take after cesarean section. Then if you have any questions regarding this, you can ask me right now. Yeah, Pushpa, you asked me, how long should you wait after a cesarean section before getting pregnant again? I would say 3 years. 3 years का gap तो आपको रखना ही रखना है. Lakshmi Mishra, you have asked me, does C-section leads to permanent pain in the stomach? No, it does not lead to permanent pain in the stomach. You may have a little bit of tingling or itching around the stitch site for a few days, but nothing is permanent. Madhvi, you have asked me when I can start exercise after C-section. See, exercise in the sense you have to be a little active after C-section. ऐसा नहीं है कि आपका C-section हो गया है तो you have to keep lying down all the time. No, you can start exercises in a simple walking. You can start, and after 3 months or 4 months, you can start your normal exercises. Are women able to breastfeed after a cesarean section? I think I have explained this quite in detail. Yes, whether it is a normal delivery or a cesarean section, the child has to be breastfed. Swati, you asked me, are postpartum complications more common in women who are given birth by C-section? No. Complications can occur in normal delivery also. Normal delivery may be taka aata hai, we call it episiotomy. There can be infection of that stitch also. Patient can have more bleeding in normal delivery also. So complications can be there in both the cases. It is not that anything is perfectly 100% safe. Are there any problems having sex after C-section? No. That is why you have to wait for 3 months after complete recovery. Akshay, it is difficult to get pregnant again after C-section? Definitely not. Because C-section is just a mode of delivery. Instead of delivering vaginally, because vaginal delivery is not possible or may hamper the life or may hamper the health of the mother or the child, that is why we are doing a C-section. So it is limited to just that. So it is not, there's nothing, it is not concerned with getting pregnant or it will hamper your future pregnancy, nothing of that kind. My take home message for today is please do not get intimidated or scared जब भी आपको सी सेक्शन करने के लिए कहा जाता है, जब भी आपको सी सेक्शन एडवाइस किया जाता है. टेक इट विद अ पॉजिटिव एटीट्यूड. Whatever doubts, fears, anxiety you have, please talk it with your doctor instead of getting this information from somewhere else. And remember that whatever he's done in the best interest of the mother and child. Secondly, do not compare your recovery with somebody else. Every body is different. So your recovery pattern, आपको ज्यादा दिन लगेंगे, किसी और को कम दिन लगेंगे. It is perfectly okay. Just accept it. Okay, do not compare your recovery with someone else. Third thing is, don't feel guilty. There are many women who feel that they have it is a failure that they have undergone a C-section and not delivered vaginally. No, you should not count it as a failure. In fact, you should look at it positively, because I'm positively thinking that you're undergoing this C-section to ensure the well-being of your child. So be a proud mother. It is nothing to be ashamed of, or don't think of it as a failure to deliver vaginally. It is in nobody's hands. So with this, I wish you all a joyful motherhood and pregnancy. Thank you.